The One Big Beautiful Bill Act of 2025, OBBBA, includes a staggering number of over 35 healthcare provisions that are set to reshape the landscape of health coverage across the United States. These provisions affect a wide range of programs such as Medicaid, the Children's Health Insurance Program, CHIP, the Affordable Care Act, ACA marketplaces, Medicare, and commercial insurance plans. What makes this especially critical to understand is how the timeline of when these provisions take effect will drive significant changes in eligibility criteria and spending, particularly within Medicaid. All of these changes are scheduled to roll out over the next 3 years, marking a pivotal period that will influence both access to care and the financial dynamics of the healthcare system nationwide. But here's where it gets controversial. Some of the new requirements for Medicaid could make it harder for many adults to maintain their coverage. Under OBBBA, states must upgrade and expand their administrative systems to include numerous new eligibility checks for Medicaid and ACA marketplace coverage, with strict deadlines they must meet to remain compliant with federal law. For adults living in states that expanded Medicaid under the ACA, there will be a tightening of eligibility rules, meaning many will need to actively report monthly on their work hours or community engagement activities to keep their Medicaid benefits. This monthly reporting requirement is a game changer, potentially adding a layer of complexity and risk of losing coverage that wasn't there before. At the same time, children in these households may still keep their Medicaid coverage, but they will also have to take separate steps to stay enrolled, creating a more fragmented process for families to navigate. Healthcare providers won't be watching this unfold passively, either. The way the OBBBA provisions alter funding mechanisms and coverage options will have a direct impact on how providers manage care delivery. Changes in coverage patterns could influence how much uncompensated care hospitals and clinics must provide, affecting the financial health of healthcare institutions and potentially the quality and availability of care in the communities they serve. For those looking to truly grasp the full scope of these reforms, it's crucial to understand the timeline in which the various healthcare provisions will come into effect. This timeline, detailed by federal program and arranged to illustrate the cascading waterfall effect of implementation, is key to anticipating both the immediate and long-term consequences of the legislation. The schedule outlines when these provisions will kick in, helping stakeholders prepare for the shifts in coverage and costs that are on the horizon. And this is the part most people miss. The staggered rollout means different populations will feel the impact at different times, emphasizing the need for ongoing attention and adaptation from policymakers, providers, and beneficiaries alike. What do you think about the new monthly reporting requirements for Medicaid recipients and the potential for reduced eligibility? Could these measures improve system integrity, or will they create unnecessary barriers for vulnerable populations? The debate is open, and your perspective matters. Share your thoughts below.